Hello everybody and welcome to the Thursday edition of Video Clips. And today we're going to talk about HeartFlow, which is a new non-invasive cardiac test that was approved by the FDA. And it's getting a lot of attention because it's supposedly a superior way to look at the potential for blockages and when people need stents and that sort of thing. So there's so much useless stuff in medicine, and to keep people from signing up for useless stuff, that's why we do these videos. So anyway, I'll just start at the beginning. HeartFlow, the company, was started in 2007 by Charles Taylor and Christopher Zarins. Zarins is the chief of vascular surgery at Stanford School of Medicine. And usually when these new things start, one of the things that these companies will do is go find a really prestigious person in an academic setting or something of that nature to be the spokesperson, because that makes it easier to get everybody on board. The company owns and markets HeartFlow Analysis, which uses data from a CT scan to determine if a patient has blocked arteries and needs a stent. Now, the procedure that is currently used and has been used for a long time to measure blood pressure and blood flow is called fractional flow reserve, or FFR. It's performed in the cath lab, and it involves the use of a guide wire inserted at the groin that winds its way on up to the heart. And the objective of the test is to evaluate if there are blockages and if blood flow is restricted. Now, HeartFlow says its technology is superior to FFR, citing several advantages, including that the test is not invasive and it reduces cost. It is less expensive than the traditional FFR. Chairman Bill Weldon, formerly CEO of Johnson & Johnson, predicts that HeartFlow will be the most commonly used test to diagnose blocked arteries in the future. Well, maybe, maybe not. It could well become the most commonly used test, but there may be some reasons to be kind of concerned about it. According to Steve Nissen, chairman of cardiology at the Cleveland Clinic, HeartFlow, like many other new technologies, is being overhyped. He says, someone takes an idea that seems very sexy and attractive, but when you get down to the science, it just isn't solid. The FDA approved HeartFlow as a medical device to evaluate the status of coronary artery disease after a small study conducted in 2014. The technology was used to analyze CT scans for 254 patients and showed that it matched FFR 84% of the time in detecting a clogged artery and 86% of the time when blood flowed freely. Results from a larger registry study that looked at over 5,000 patients was published in 2018. Doctors were asked to make a treatment plan after seeing CT scans for patients and then after reviewing HeartFlow analysis based on the CT scans. Treatment plans changed for 2/3 of the patients, with most doctors shifting from wanting to know more to immediately prescribing medication. The concerning thing was that 73% of the patients either received stents or had bypass surgery, a higher percentage of patients than would have had these procedures had they just used FFR. Well, everybody always thinks that new is better and more is better, and that's not necessarily the case. In this case, there's no way to know if the increased number of procedures improved outcomes because the trial didn't follow patients long enough to make that determination. Subjects were followed for only 90 days, and there wasn't very much data collected in that period on heart attacks and deaths. Another limitation was there was no control group that just got traditional treatment and intervention to compare the patients to. There are some other reasons to doubt the technology. According to an analysis published in JAMA Cardiology, CT scans to measure flow are less accurate in sicker patients. While a study showed that HeartFlow improved accuracy over CT alone, the study failed to achieve its objective of 70% diagnostic accuracy, which was the threshold set forth to deem it effective. Yet another issue is stents themselves. There's no question that stents save lives when people get to the hospital in the middle of their myocardial infarction or if they have unrelenting chest pain. But research has shown that in most other cases, they're not much better than medication alone. A 2007 study concluded that stents did not reduce the risk of death, non-fatal myocardial infarction, or hospitalization for acute coronary events. That's not all. The AVERT study, which involved randomizing patients to take Lipitor or to have angioplasty, showed that patients who just took Lipitor had fewer heart attacks, less chest pain, and fewer visits to the hospital than those who had angioplasty. So some studies show that the outcomes are worse for the patients who have stents. A study conducted by Dr. Justin E. Davies and his colleagues in the UK is possibly the most interesting data we have on stents. And how much they're overused in cardiology practice. The study included 200 patients who had blocked arteries and chest pain and as a result engaged in limited physical activity. Patients of this type are almost always stented. All of the patients were given drugs like aspirin, statins, and blood pressure medications in order to reduce the risk of heart attack. They then were randomized to receive a real or fake insertion of a stent. Now you might wonder, how do you fake insert a stent? Well, the doctors used a catheter to reach the blocked artery, inserted a stent in the intervention group patients, and then pulled the catheter out without inserting a stent in the control group. 6 weeks later, no difference between the groups. Patients in both groups said they had less chest pain and both did better on treadmill tests. So apparently there's a placebo effect from having a stent or not having a stent. Last but not least, it's important to consider the fact that angioplasty involves risks and there are frequent complications. Often, the inflating of the balloon nicks a plaque and causes the toxin ingredients to be spilled out, and that leads to clotting and a heart attack, the very thing that stents are supposed to prevent. Well, the result is between 15,000 and 20,000 heart attacks and 10,000 deaths per year during the procedure. Now think about what would happen if 10,000 people died every year in the United States in airplane crashes. We'd probably be taking we might even ground all the planes till we figured out what the heck was going on with that, right? Well, in spite of its limitations and failure to prove that HeartFlow improves long-term outcomes, HeartFlow is covered by most insurance plans, and the problem with that is that it makes it easy for patients to say yes to something. I think a lot more consideration would be given, well, we have data showing that a lot more consideration is given to whether or not to do something when patients actually have to pay out of pocket. Cardiologists are already gushing about what a game changer it's going to be. Robert Safian is a cardiologist at Beaumont Health in Royal Oak, Michigan, and here's what he has to say. Initially, I was one of the worst skeptics, but now I'm completely converted and I think it's amazing technology. Well, he claims to have used it on 2,000 patients at this point, but maybe it's the $3,000 he got from HeartFlow for expenses that helped him change his mind. I don't know. I always feel better if you can get some type of enthusiastic response from somebody who isn't being paid to give it. You know, that always makes me uncomfortable. Well, the bottom line with this, so much of what I talk about is just a continuing theme, and it's where medicine makes the same mistakes over and over again. New doesn't always mean better, and more caution needs to be exercised before adopting new practices, but this doesn't happen. You know, what I think is going to happen with HeartFlow is it's the same as we see all the time. Everybody gets all enthusiastic about it. Before you know it, it's the standard of care in cardiology. Everybody knows it's fabulous, and when evidence finally definitively shows this is not a good idea, and I think there's enough question about it that that's how this could end up, it's almost impossible to dial it back. And in fact, one thing that just goes to the point, I remember a few years ago I reported on something called Choosing Wisely. And this was where a group of 80 different practice groups got together and said, let's come up each with 10 things that we do, that we should do not at all or less of. And then we'll put together evidence and post it on this website. And I think that sounds like a wonderful idea. It's a way to reduce waste in medicine and do better by patients. So all these practice groups did this, and then a few years later, another group said, let's see what has happened in response to some of the things that were posted on the Choosing Wisely website, which were supposed to be used less frequently or not at all. And in every single one selected, it was being used more, not less, than when that website was created. It's just unbelievable. I mean, it's just hard to fathom that physicians don't take more responsibility for reading the medical literature and keeping up on this stuff. And I always teach through analogy, so I always look at it this way. If you went to see your accountant at tax time and he informed you that he hadn't read the United States tax code since 1978, I think you probably would pick up your papers and go someplace else, because you have to keep up with things. So anyway, I know I always sound like the bearer of bad news, and one person wrote to me and said, why are your videos always so negative? The purpose is not to be negative, the purpose is to be informed, and you should feel lucky that you're being informed, because not being informed can cost you your life in some situations. So don't mean to be negative all the time. The positive spin is be informed to make better decisions. All right, as usual, I'll pass this on to anybody who you think might enjoy watching it. Hit that subscribe button. We're trying to increase our subscriber base. We're going to have some giveaways as we reach certain benchmarks. You want to see these videos every week. I'll be back to you next Tuesday with more news.